Keeping an eye on mental health, a bill is making its way through the legislature aimed at addressing a crisis in youth mental health. You might remember Children's Hospital Colorado declared a state of emergency 2 years ago. Its ER is overrun with kids attempting suicide.
Yeah, that crisis sadly has not gone away. The challenge is getting children who have been stabilized into the right care. Well, now they can spend days on end just waiting in the ER.
For all the kids who are out there in pain, it truly is a distressing situation, just as an individual, as a physician whose job it is to try to help people in these situations. I oftentimes feel at a loss to help, particularly when there's a kid who looks very similar to my daughter staring at me, and I can't fix the problem in front of me.
ER doctor Kevin Carney describes the heartache that he and other children's hospital staff feel.
I actually have children and adolescents.
When there aren't enough available beds.
No beds today. Okay, no expected discharges either.
Children who have arrived in crisis, not ready to return home, but they have to stay in the ER because there's nowhere else to go for continued care.
Walking through our emergency department and looking into a patient's room who has been here for multiple days will knock you back, and it takes your breath away. It makes you cry. When you go home at the end of the day, it makes you reflect on it and really just feel that we're not doing enough.
I think it's a story that needs to be told.
Children's Zach Zaslow went to the state capitol to drive the urgency for solutions.
All the things that make a young person whole and help with their social and emotional development, they're separated from all of that because we don't have a system that can keep them safe anywhere else. If we could build that middle part of the continuum, those intensive services for kids who need a smooth handoff back to their local community, we could be doing so much better.
In especially equipped rooms, the emergency department is able to keep kids safe. But when they can't move forward with what the experts know is the path to recovery, they're left to wait sometimes for days or weeks, or they go home only to return back to the ER.
And when we hand off a patient shift after shift and we say, so-and-so is still here, it's a sad conversation because we all know what that implies, which is that that kid is not getting the care that they need.
State lawmakers are expected to pass a bill this week that would create a funding pool to incentivize residential treatment providers. Now, the goal, of course, is to expand intensive treatment options for children with behavioral health needs.